And then next we'll talk about B, C, and D collectively because they are transmitted through the same route. So while A and E are transmitted through fecal-oral, B, C, and D are transmitted through direct contact with blood and bodily fluids. So we'll talk about hepatitis B first. So as I mentioned, you will get this through contact with blood and bodily fluids. So what you would likely experience is things like abdominal pain from the inflammation of the liver, obviously jaundice, which is characteristic for hepatitis, and then vomiting. This particular infection can definitely be more serious. Patients can become chronically ill, and it can lead to liver cirrhosis and even death. Hepatitis B is unfortunately the leading cause of liver cancer. When this virus infects cells in the liver, it can cause those cells to grow and divide rapidly, which ultimately can lead to cancer. So hepatitis B is a very serious infectious disease. Fortunately, it is one that can be prevented, so there is a vaccine that can protect you against hepatitis B. Should you get hepatitis B, it can be treated. It's treated with supportive care to help with the impact on the liver, and then also antiviral medications. But ideally, it can be prevented before you acquire it through use of the vaccine. So hepatitis D is unique because it is defective. So that's kind of how I always remember it, D for defective, in the sense that this virus cannot cause an infection if it gets into the body alone. So if you get infected with hepatitis D through contact with blood or bodily fluids that has this virus, if you're infected with that alone, you will not get sick. So the virus is defective. Once it gets into a cell, it has no ability to replicate itself, so it eventually becomes inactive. It is only a problem if someone is already infected with hepatitis B. So the way hepatitis D works is if you're already infected with hepatitis B, it can exacerbate or worsen the hepatitis B infection. The hepatitis D virus needs genetic material from the hepatitis B virus in order to replicate itself. So if a host becomes infected with these two viruses, it will make their hepatitis B infection much worse, more likely to lead to cirrhosis, liver cancer, and potentially even death. So as far as prevention, there is no vaccination that will protect you against hepatitis D, but if you're protected from hepatitis B because you have the Hep B vaccine, then indirectly you're protected from hepatitis B you're indirectly protected from hepatitis D because D will only affect you if you are infected with hepatitis B. Other than that, it's avoiding contact with blood and bodily fluid exposure. So then the last form of hepatitis is hepatitis C. Hepatitis C is also a very serious, potentially life-threatening form of hepatitis. So this disease is also transmitted through contact with blood or bodily fluids. So with hepatitis B, it is unique in the sense that when you become infected with this virus, there will be a period of time where you're asymptomatic, so you won't actually know that you have the infection. But then eventually the infection will progress, and you'll get those kind of standard hepatitis symptoms. So abdominal pain from the inflammation of the liver, get the yellowing of the skin with jaundice, and then vomiting. Again, as the infection progresses, it eventually becomes worse and worse to the point where it does cause cirrhosis, and ultimately, if not treated, will necessitate a liver transplant or potentially lead to death. So it is the leading cause of liver transplants in the United States. So while hepatitis B is more likely to lead to liver cancer, hepatitis C is more likely to destroy the liver over time because of its ability to establish a chronic infection and ultimately necessitate a liver transplant. Fortunately, Hepatitis C is treatable. There's not a vaccine that can protect you against it, but you can avoid it through avoiding at-risk activities, such as contact with blood and bodily fluids. So avoiding intravenous drug use, unprotected sexual intercourse, those sorts of things. Fortunately, if you get it and you seek antiviral treatment, nowadays there is a 95% cure rate. It wasn't always like that. Before they found antiviral medications, if you contracted Hep C, it would become chronic. You would have it for a lifetime. It would eventually destroy your liver to the point that you would need a liver transplant or you would ultimately die. But fortunately nowadays, due to antiviral medication, individuals who seek medical care will most likely make a full recovery. So the last infectious disease category is kind of a class of infections called viral hemorrhagic fevers, and these ones are actually quite terrifying. Viral hemorrhagic fevers are various viral pathogens that essentially, once they get into a host, they cause profuse hemorrhaging from the host, where the infected individual will essentially bleed out. So these diseases are often life-threatening. So there's several different viruses that can cause hemorrhagic fevers. Some examples are Ebola, yellow fever, Marburg, and the dengue virus. What these viruses all have in common is that while they can cause kind of non-specific signs and symptoms like fever, fatigue, things we experience with everything, in severe cases, they can all cause hemorrhaging. So basically what happens is these viruses get into the cardiovascular system and they cause the blood vessels to hemorrhage throughout the body. So you would essentially start to bleed out from every orifice of your body as well as all your internal organs. Ultimately, if you're losing blood from all your organs and tissues in the body, you're going to go into organ failure because they're not going to be getting enough oxygenated blood, and then ultimately that is fatal. So these diseases, because of their hemorrhaging capabilities, they typically are life-threatening. They're transmitted in a variety of different ways. It just honestly depends on the virus. So for example, something like Ebola, that can be transmitted through blood and bodily fluids of someone that has the infectious disease. So obviously a patient that has Ebola is going to be hemorrhaging from orifices. So for example, if they would vomit up blood and then you came in contact with that blood and then it got into your body, you could potentially get it that way. They can be transmitted through infected animals. So Ebola has also been transmitted through the bite of a bat. And they can also be transmitted through insects, such as mosquitoes, is what we would see with something like the dengue virus or yellow fever. So a variety of different routes of transmission. Fortunately, these diseases are rare in the United States. Cases that we've seen in the United States are just from people that traveled to areas where these diseases are present and then got sick when they came back. Fortunately, they were isolated and hasn't led to any type of epidemic outbreak. But areas where we would see this as a consistent problem would be developing portions of the world, Africa, South America, Asia. There's supportive treatment only, so it's kind of a nice way for saying no treatment. There's no antiviral medications, but they would watch the fever, give medications to make people more comfortable, but there's unfortunately not a lot that they can do to destroy the virus. So what they usually focus on is trying to make the person's immune system stronger so that the immune system can fight the infection. And unfortunately, there is no vaccines associated with these infectious diseases as well.